Are you perhaps worried that your body isn't working quite as well as it used to? Maybe you're concerned about something as vital as your kidney function. You know, many seniors quietly face these kinds of health concerns, and it's really important to understand how our bodies clear waste products, like creatinine. Problems in this area can actually signal some serious kidney or even broader health issues. Now, creatinine is a natural waste product that comes from our muscle activity, and normally, healthy kidneys filter it right out. But if your body isn't clearing creatinine effectively, certain warning signs can start to show up, possibly pointing to kidney dysfunction. So, in this discussion, we're going to explore 6 key signs that your body might not be clearing creatinine properly. We'll be looking at what clinical evidence and expert guidance tell us, hopefully offering you some clarity and actionable steps. Number 1, swelling or puffiness, especially around eyes and ankles. One of the most noticeable signs that your body might be struggling to clear creatinine effectively is when you start to see swelling, which doctors call edema. This swelling often shows up in specific places, like around your eyes, especially in the morning, and in your ankles and legs, particularly as the day goes on, or if you've been standing or sitting for a while. You see, when your kidneys aren't filtering waste products and excess fluids from your blood as well as they should, this fluid can build up in your body's tissues, and that's what leads to that visible puffiness. The connection here between not clearing creatinine properly and this swelling is all about the kidney's job in keeping our fluids balanced. Healthy kidneys are meticulous. They regulate the amount of sodium and water in our bodies. But if kidney function declines, they might not be able to get rid of enough sodium. And since water tends to follow sodium, this retention of sodium causes fluid to build up in what we call the interstitial spaces. Those are the areas around our cells and tissues, and that's what shows up as swelling. This puffiness around the eyes, known as periorbital edema, can be particularly alarming because it's often one of the first places where fluid accumulation becomes noticeable, thanks to the delicate and loose skin in that area. Similarly, swelling in the ankles and feet, called peripheral edema, happens because gravity pulls that excess fluid downwards. You might notice your shoes feeling tighter, or if you press a finger into the swollen area, it might leave a temporary dent. That's a phenomenon known as pitting edema. Now, while a little bit of mild swelling now and then can be due to various things, if it's persistent or getting worse, especially if you have other symptoms, it really warrants a closer look at your kidney function and creatinine levels. Paying attention to this sign is crucial for early detection. But swelling isn't the only way your body might signal trouble. Changes in your urination patterns can also be a really significant clue. Number 2, passing low amounts of urine or trouble urinating. A significant change in your urinary habits, especially if you're producing less urine than usual or you're having trouble when you try to urinate, can be a really telling indicator that your kidneys aren't clearing creatinine and other waste products as efficiently as they should. You see, your kidneys are responsible for making urine as a way to get rid of these wastes and any excess fluid. So, when their filtering capacity is compromised, the amount of urine you produce can decrease quite noticeably. You might find yourself going to the restroom less often, or when you do go, the volume of urine is substantially less. This condition, known as oliguria, is defined as producing less than about 400 to 500 milliliters of urine a day. That's roughly less than 2 cups. In more severe cases, urine output might drop even further, or it might stop almost completely, which is a condition called anuria, and that signals a critical problem with kidney function. Now, beyond just the amount of urine, difficulty in the act of urinating itself can also be a symptom tied to underlying kidney issues that affect creatinine clearance. This could show up as a hesitant or weak urine stream, a feeling that your bladder isn't emptying all the way, or even pain or a burning sensation during urination. That last one might also suggest a urinary tract infection, which, if left untreated, could potentially affect kidney function. While things like prostate issues in men or other urinary tract problems can cause these kinds of symptoms, if they pop up alongside other potential signs of kidney distress, it really should prompt a thorough evaluation. Monitoring your urine output and noting any difficulties can provide some truly valuable information for your healthcare provider. And while changes in urination are a direct reflection of kidney activity, the impact of poor creatinine clearance can also show up in how energetic you feel. Number 3, persistent fatigue and weakness. Feeling unusually tired or weak, even after you've had what seems like enough rest, can be a pervasive and often overlooked symptom of impaired creatinine clearance and declining kidney function. And we're not just talking about ordinary tiredness here. This is a profound lack of energy that can really interfere with your daily activities and significantly reduce your quality of life. When your kidneys aren't filtering waste products like creatinine effectively, these toxins can build up in your bloodstream, leading to a state that's often described as uremic fatigue. This buildup of toxins can affect various bodily functions, which contributes to those feelings of lethargy and just general malaise. What's more, our kidneys play a vital role in producing a hormone called erythropoietin. This hormone signals your bone marrow to make red blood cells. So, if kidney function is compromised, erythropoietin production can decrease, and that can lead to anemia, which is a shortage of red blood cells. Anemia means less oxygen is being delivered to your muscles and your brain, and that directly results in feelings of weakness, tiredness, and difficulty concentrating. You might notice that you just don't have the stamina for activities you once enjoyed, or perhaps you need to rest more frequently throughout the day. This fatigue can also be accompanied by a general sense of just feeling unwell. It's easy to dismiss persistent tiredness as a normal part of aging or maybe stress, but if it's a new or worsening symptom, especially if it's happening alongside other signs we're discussing, it's really important to consider that your kidneys might be struggling. Often, addressing the underlying kidney issue can help alleviate this debilitating fatigue. Now, beyond feeling drained, issues with creatinine clearance can also directly impact your digestive system. Number 4, nausea, vomiting, and loss of appetite. When your body isn't effectively clearing creatinine and other waste products because of kidney dysfunction, these toxins can accumulate in your bloodstream, a condition we call uremia. This buildup can directly irritate the lining of your stomach and even affect the part of your brain that controls nausea and vomiting. As a result, you might experience persistent nausea, especially in the morning, or you might find yourself vomiting without a clear cause, like a stomach bug. This constant feeling of sickness can, quite naturally, lead to a significant loss of appetite. Foods that you once enjoyed might no longer seem appealing, or you might feel full quickly after eating only a small amount. Some people also report a metallic or unpleasant taste in their mouth, which can further dampen the desire to eat. This poor appetite and reduced food intake can contribute to unintentional weight loss and malnutrition, which then further compounds the fatigue and weakness associated with kidney problems. The presence of nausea, vomiting, and loss of appetite, especially when they occur together and persist over time, really shouldn't be ignored. While these symptoms can be associated with various gastrointestinal issues, their link to uremia makes them important indicators of potential kidney distress and impaired creatinine clearance. So, if these digestive disturbances are impacting your ability to eat and maintain your nutrition, it's crucial to discuss them with your healthcare provider to investigate the underlying cause, which could very well be related to how well your kidneys are functioning. And as troubling as digestive issues can be, problems with creatinine clearance can also affect something as vital as your breathing. Number 5, shortness of breath and chest pain. Experiencing shortness of breath or even chest pain can be quite alarming symptoms, and in some instances, they may be linked to your body's inability to clear creatinine properly and the underlying kidney dysfunction. There are a couple of ways kidney problems can lead to these respiratory difficulties. Firstly, as we touched on earlier, impaired kidney function can lead to fluid overload. If excess fluid accumulates in the lungs, a condition known as pulmonary edema, it can make breathing difficult. You might feel like you just can't get enough air, especially when you're lying down or during physical exertion. Secondly, severe kidney disease can lead to something called metabolic acidosis. This is a condition where the body's pH balance becomes too acidic because the kidneys can't remove enough acid from the blood. To compensate, your body might try to expel more carbon dioxide, which is an acid, by increasing your breathing rate, and that can feel like shortness of breath. Now, while chest pain related to kidney disease is less common than shortness of breath, it can occur if uremia leads to inflammation of the sac surrounding the heart, a condition called pericarditis. This can cause a sharp, stabbing chest pain that might worsen when you breathe or lie down. It's absolutely critical to remember that chest pain and significant shortness of breath can also be signs of serious heart conditions, and therefore they always require immediate medical evaluation to rule out any life-threatening emergencies. However, if these symptoms are part of a broader picture that includes other signs of kidney issues, then investigating creatinine clearance becomes essential. And beyond internal discomfort and breathing issues, your skin can also reflect problems with waste clearance. Number 6, itching and skin changes. Persistent and troublesome itching, often described as pruritus, can be a very uncomfortable sign that your body isn't clearing creatinine and other waste products effectively. When kidneys fail to filter these substances from the blood adequately, they can accumulate and actually deposit in the skin. This buildup can trigger a widespread, intense itch that isn't easily relieved by scratching or typical anti-itch creams. Sometimes, the itching can be so severe that it disrupts sleep and significantly impacts your quality of life. In addition to itching, you might notice other changes in your skin. Your skin may become unusually dry and flaky. Some individuals with advanced kidney disease develop a sallow or yellowish-brown complexion due to the retention of waste pigments that would normally be excreted in urine. In some cases, a condition known as uremic frost can occur. This is where urea and other waste products crystallize on the skin's surface as sweat evaporates, though this is typically seen in very advanced stages of kidney failure. These skin manifestations are a direct result of the systemic effects of uremia when creatinine and other toxins aren't being properly cleared. So, if you're experiencing persistent, unexplained itching or noticeable changes in your skin's texture or color, particularly if it's accompanied by other symptoms we've discussed, it's wise to consider your kidney health and consult a healthcare professional. These skin signals can be an external indicator of an internal imbalance that really needs attention. Now, recognizing these 6 primary signs is crucial, but it's also important to be aware of other potential indicators that might accompany them. Other possible symptoms and overlapping conditions. Beyond the 6 primary signs we've detailed, a range of other symptoms can also suggest that your body is struggling to clear creatinine and that your kidney function might be compromised. These can include difficulty concentrating, or what some people call brain fog, as the buildup of toxins can affect cognitive function. Some individuals may experience muscle cramps, particularly in the legs, which can be related to electrolyte imbalances often seen with kidney issues. Sleep problems, such as insomnia or restless leg syndrome, are also commonly reported by those with kidney disease. It's also really important to recognize that many symptoms of impaired creatinine clearance can overlap with other health conditions, especially those that are prevalent in seniors, like diabetes and hypertension. and these themselves are major risk factors for kidney disease. For instance, fatigue is a common symptom in many chronic illnesses, and swelling can be related to heart failure or liver problems. Therefore, a comprehensive evaluation by a healthcare provider is absolutely essential to determine the precise cause of your symptoms and to assess your kidney health accurately. This is usually done through blood and urine tests that measure creatinine levels and what's called the glomerular filtration rate, or GFR, when to seek medical attention and next steps. If you're experiencing one or more of the signs we've discussed, especially if they're new, persistent, or worsening, it is so important to seek medical attention promptly. Please don't dismiss these symptoms as just a part of getting older. Early detection of kidney problems is absolutely key to slowing their progression and preventing more serious complications, such as end-stage renal disease, which might require dialysis or even a kidney transplant. Your doctor will likely start by discussing your symptoms and your medical history. They will then typically order blood tests to check your creatinine and blood urea nitrogen, or BUN levels, as well as calculate your estimated glomerular filtration rate, your eGFR, which is a key indicator of kidney function. A urine test, called a urinalysis, may also be performed to look for protein, blood, or other abnormalities. Depending on these initial findings, further investigations, like an ultrasound of your kidneys, might be recommended to identify any structural problems. Remember, taking proactive steps by consulting your healthcare provider allows for timely diagnosis and management, and that leads to better health outcomes. Recognizing the symptoms of impaired creatinine clearance early is a truly vital step in safeguarding your kidney health and your overall well-being. These warning signs are your body's way of signaling potential issues that really need attention. If you experience any of the symptoms we've outlined, please don't hesitate to speak to your healthcare provider to assess your kidney function thoroughly. If you found this information helpful, please do share this article with your friends, family, or anyone who might benefit from understanding these important health signals. We also invite you to comment below with your experiences or any questions you might have, and remember to subscribe for more health updates and valuable kidney health tips.